June 7, 1944. 13:47 hours. American Field Hospital, Omaha Beach Sector, Normandy. Obergefreiter Franz Meyer felt the shrapnel in his thigh grinding against bone with each step. Blood soaked through his field dressing, applied 3 hours ago by a sanitator who'd been killed moments later by artillery fire. When American paratroopers surrounded his position near Carentan, Meyer expected a bullet to end his war quickly. Instead, he found himself on a canvas stretcher, carried by 2 GIs who moved with practiced efficiency toward a collection of olive-drab tents marked with red crosses. The morphine syringe one of them jabbed into his arm took effect before he could protest. Pain that had been excruciating became a distant ache. "Easy there, Fritz," said the medic in broken German. "You're gonna be fine." This wasn't propaganda or mercy alone. It was policy that treated every wounded soldier as worth saving, revealing to German POWs a medical system where even enemy lives mattered enough to preserve with the same resources devoted to American casualties. The collapse of German medical services. By the summer of 1944, German frontline medical services had deteriorated to levels that shocked even veteran Wehrmacht soldiers. The systematic bombing of pharmaceutical plants had eliminated most domestic production of antibiotics and painkillers. Morphine supplies had been exhausted months earlier. Field hospitals operated without anesthetics, performing amputations with soldiers biting leather straps. The evacuation system that had functioned efficiently during the early war years had collapsed under fuel shortages and constant air attack. Wounded soldiers often waited days for transport to rear medical facilities, dying from infections that proper treatment could have prevented. Medical personnel themselves suffered from malnutrition and exhaustion that compromised their effectiveness. Sanitator Klaus Weber had served as a combat medic since 1941, treating wounded from Poland through Russia to France. His medical kit in June 1944 contained bandages made from paper, ersatz antiseptic that barely functioned, and pain relief limited to aspirin tablets when available. "We did what we could with nothing," he testified after capture. "Bandages that fell apart when wet, antiseptic that was mostly water. No antibiotics, no blood plasma, no morphine. Men died from wounds that should have been survivable because we had no supplies to treat them properly. What an ice wearies." The contrast with what German prisoners encountered in American medical facilities was so stark that many initially suspected deliberate psychological manipulation. How could an enemy provide better medical care to prisoners than Germany provided to its own soldiers? The arsenal of healing. American medical logistics in 1944 operated with abundance that German medical officers found incomprehensible. The United States was producing penicillin at rates that supplied not just American forces, but Allied armies and even enemy prisoners under Geneva Convention obligations. The numbers revealed systematic commitment to preserving life that extended even to enemies. Penicillin production reached 650 billion units monthly by mid-1944, with military distribution prioritized but sufficient for prisoner treatment. Blood plasma production exceeded 13 million units annually, with Type O universal donor plasma available at every aid station. Morphine syringes were standard issue to every medic, with enough supply to treat severe pain immediately rather than rationing for only the most critical cases. Medical evacuation systems moved wounded from front lines to field hospitals within hours, then to base hospitals within days. Dedicated hospital ships and aircraft provided transport that prioritized medical needs over military logistics. Surgical facilities included equipment that exceeded most civilian hospitals in pre-war Germany. The medical supply chain demonstrated industrial capacity applied to humanitarian purposes. Bandages, antiseptics, surgical instruments, and medications flowed to frontline units with reliability that German forces had never experienced. Medical personnel received training that emphasized life preservation over resource conservation. First contact with American medicine. The initial encounter with American medical care consistently shocked German prisoners who had been conditioned to expect brutality or neglect in captivity. The contrast between their expectations and reality created cognitive dissonance that challenged fundamental assumptions about enemy character. Lieutenant Otto Brandt had been wounded by shell fragments during the fighting in the Cotentin Peninsula. His company commander had told the wounded to expect execution if captured. American troops supposedly showed no mercy to SS personnel. When Brandt lost consciousness from blood loss, he assumed death was imminent. "I woke up in a tent with white walls and bright lights," he testified years later. An American doctor was stitching my abdomen. A nurse, a woman, was monitoring my pulse. They had started a blood transfusion while I was unconscious. The blood was flowing into my arm through rubber tubing I'd never seen before. The blood transfusion particularly disturbed Brandt's worldview. German medical doctrine considered blood transfusions experimental procedures justified only for critical cases involving German personnel. The casual use of American blood to save an enemy soldier suggested resources so abundant that human life took precedence over military necessity. The medical personnel treating Brandt showed professional competence that exceeded his previous medical experiences. The surgical technique was precise, the wound care meticulous, and the pain management effective. More psychologically disturbing was their attitude. They treated him exactly as they would treat American casualties. The mathematics of medical abundance. Major Paul Hawthorne commanded a frontline surgical hospital that processed casualties from the Normandy breakthrough. His facility represented American medical capability that operated beyond German comprehension, not just in equipment and supplies, but in fundamental philosophy about the value of human life. "We treated everyone," he wrote in his medical journal. "Americans, British, Canadians, Germans. The uniform didn't matter once they hit our operating tables. The Hippocratic Oath doesn't recognize national boundaries, and our supply situation meant we could afford to honor that principle." Hawthorne's hospital consumed medical supplies daily that exceeded monthly allocations for entire German medical units. Penicillin injections that German doctors reserved for only the most critical infections were administered routinely to prevent minor wounds from becoming serious. Surgical procedures that German facilities couldn't attempt due to resource limitations were performed as standard treatments. The abundance extended beyond immediate medical care to rehabilitation and recovery. American hospitals provided physical therapy, occupational training for amputees, and psychological counseling for traumatic stress. German prisoners received prosthetic limbs manufactured to the same standards as those provided to American veterans. The statistical evidence was overwhelming. Survival rates for wounded German prisoners in American medical facilities exceeded 95%, compared to estimated survival rates below 60% in German military hospitals during the same period. The difference wasn't just medical, it was philosophical and industrial. The penicillin miracle. The availability of penicillin to treat German prisoners represented perhaps the most shocking demonstration of American medical abundance. This miracle drug had been virtually unknown to German medical personnel, who continued treating infections with pre-antibiotic methods that often proved fatal. Corporal Franz Mayer's leg wound had become infected during the 3 days between injury and capture. German medical doctrine would have required amputation to prevent septicemia. Instead, American medics administered penicillin injections that cleared the infection within 48 hours. "I thought they were poisoning me," Mayer recalled. "The injection hurt. Then nothing happened for hours. I expected to die. Instead, the fever broke. The wound stopped draining pus, and the swelling went down. It was impossible. Wounds like that meant amputation or death arose." The psychological impact extended beyond individual treatment to broader understanding of comparative medical capabilities. If Americans could afford to use experimental wonder drugs on enemy prisoners, what did that suggest about their overall research and manufacturing capacity? German medical officers who witnessed penicillin treatment consistently reported shock at both its effectiveness and casual availability. Dr. Wilhelm Koch, captured while serving with a Panzer Division's medical unit, observed American medical procedures for weeks before his own evacuation to a POW camp. They used penicillin like we used aspirin, he testified. Routine administration for any sign of infection. Cases that would have been fatal in our field hospitals were treated successfully with a few injections. The waste seemed incredible, until you realized it wasn't waste, but abundance. The blood supply system. The American blood supply system demonstrated organizational capability that German medical services had never achieved. Type O negative blood was available at every aid station, with refrigeration systems maintaining quality during transport and storage. Blood transfusions had been attempted by German medical units, but remained experimental procedures requiring extensive preparation and careful matching. American medical facilities performed transfusions routinely, with blood banks maintaining supplies sufficient for mass casualty events. The sight of their own blood flowing into German prisoners created profound psychological impact among captured medical personnel. Unterarzt Heinrich Müller had performed emergency surgery throughout the war, losing patients regularly to blood loss that transfusions could have prevented. "They connected me to a bottle of American blood," he wrote in his prison diary. "Type B positive, the same as mine. Someone in America had donated this blood, not knowing it would save a German soldier's life. The generosity was incomprehensible, giving your blood to keep enemies alive." The blood supply system represented industrial medicine applied to humanitarian purposes. Blood collection, processing, typing, and distribution operated with efficiency that treated human life as infinitely valuable rather than strategically expendable. The Nursing Corps. American military nurses provided medical care that shocked German prisoners accustomed to male-dominated medical services. The professional competence and authority of American women in medical roles challenged German assumptions about gender capabilities and social organization. Lieutenant Margaret Ellis had trained at Johns Hopkins before commissioning in the Army Nurse Corps. Her surgical assistant skills exceeded those of many German medical officers, and her patient care demonstrated training that emphasized comfort alongside clinical treatment. "They stared at us like we were aliens," she recalled decades later. German prisoners couldn't understand women working in forward medical facilities, making medical decisions, even assisting in surgery. Some refused treatment from female personnel until they realized we were often more skilled than the doctors they'd known. The nursing care provided to German prisoners included attention to psychological as well as physical needs. Nurses learned basic German phrases to communicate with patients, provided writing materials for letters home, and arranged for religious services when requested. This holistic approach to medical care revealed American medical philosophy that viewed patients as complete human beings rather than damaged military assets. The contrast with German military medicine, which focused narrowly on returning soldiers to combat duty, was stark and psychologically devastating. The field hospital experience. American field hospitals processing German casualties operated with organizational efficiency that demonstrated systematic preparation for mass medical care. Unlike German medical facilities that improvised solutions to supply shortages, American hospitals functioned according to established protocols that assumed abundant resources. The physical facilities themselves shocked German medical personnel. Prefabricated surgical units with electric lighting, sterilization equipment, and climate control created operating conditions that exceeded most civilian hospitals in wartime Germany. Portable X-ray machines allowed diagnostic procedures that German field medicine couldn't perform. Staff Sergeant Robert Chen, A medical technician who processed hundreds of German prisoners noted their consistent reactions. They kept asking if this was a permanent hospital, not a field facility. The equipment, the cleanliness, the organization, they couldn't believe we could set up full surgical capability in temporary buildings. The surgical procedures performed on German prisoners demonstrated technical capabilities that German military medicine had never achieved. Neurosurgery, orthopedic reconstruction, and plastic surgery were performed routinely rather than being reserved for special cases. German prisoners observed American medical teams working with resources that eliminated most constraints on treatment options. The question wasn't whether treatment was possible, but which approach would achieve optimal results. This abundance of choice was foreign to German medical personnel accustomed to making do with limited options. The psychological impact of receiving superior medical care from enemies proved more disorienting than physical wounds for many German prisoners. Men raised on propaganda about American weakness and brutality faced evidence that contradicted every assumption about enemy character. Hauptmann Friedrich Weber, a company commander captured near Saint-Vit, required emergency surgery after taking shrapnel in the abdomen. The American surgical team saved his life with procedures that exceeded anything he'd witnessed in German military hospitals. "I lay there thinking about propaganda we'd been told," he wrote in a letter smuggled home months later. Americans were supposed to be weak, cowardly, incapable of sacrifice. Yet, they were saving my life with blood donated by their civilians, medicine they could have reserved for their own soldiers, and skill that proved their medical training was superior to ours. The cognitive dissonance created by receiving excellent medical care from supposed inferiors forced fundamental re-evaluation of Nazi racial theory and military doctrine. If Americans were subhuman, how could they demonstrate such advanced medical capabilities? If they were weak, how could they afford to save enemy lives? The rehabilitation process. American military hospitals provided rehabilitation services to German prisoners that exceeded treatment many would have received as civilians in pre-war Germany. Physical therapy, occupational training, and prosthetic fitting were standard services rather than special accommodations. German amputees received artificial limbs manufactured with precision that enabled near-normal function. The prosthetic technology incorporated materials and engineering that German industry couldn't match even for its own veterans. Training programs taught prisoners to use prosthetics effectively, ensuring maximum functional recovery. Corporal Hans Richter lost his left leg to a mine near Cherbourg. The American prosthetic he received allowed him to walk without assistance and even participate in recreational activities. The contrast with German prosthetics, crude wooden substitutes when available at all, was psychologically devastating. "They gave me a leg better than my original," he testified after repatriation. American engineering, precision manufacturing, custom fitting. I could run, even dance. Meanwhile, German amputees received wooden pegs if they were lucky. The difference showed which side was truly advanced. The medical supply chain. The medical supply chain supporting American prisoner care demonstrated logistical capabilities that extended far beyond combat necessities. Specialized medications, surgical instruments, and diagnostic equipment reached frontline medical facilities with reliability that German forces had never experienced. Medical supplies flowed through distribution networks that prioritized life preservation over resource conservation. Antibiotics, analgesics, and surgical materials were consumed at rates that would have exhausted German medical stocks in days. Yet American supplies remained consistently available. The abundance reflected industrial capacity specifically devoted to medical production. Pharmaceutical plants, medical device manufacturers, and supply distribution systems operated independently of combat material production, ensuring medical needs could be met without compromising military requirements. German medical officers who observed American supply operations consistently reported disbelief at the casual availability of items that German forces had been unable to obtain for months. The systemic abundance suggested economic resources that made medical care a priority rather than a luxury. The dental care revelation. American military dentistry provided services to German prisoners that exceeded civilian dental care available in pre-war Germany. Regular dental examinations, cavity treatment, and preventive care demonstrated systematic attention to health maintenance rather than emergency intervention. Many German prisoners had never received professional dental care beyond emergency extractions. The comprehensive dental treatment provided in American facilities included procedures that preserved teeth rather than simply removing problems. The dental equipment and techniques impressed captured German medical personnel familiar with civilian dental practices. American military dentists used materials and methods that represented advancement beyond European standards, creating treatment outcomes that exceeded expectations. The systematic attention to dental health as part of overall medical care demonstrated American medical philosophy that viewed human health holistically rather than addressing only immediate problems. This comprehensive approach revealed resources devoted to prisoner welfare that exceeded basic humanitarian requirements. The mental health recognition. American military medicine recognized psychological trauma as a legitimate medical condition requiring treatment rather than discipline. German prisoners suffering from combat stress received counseling and therapeutic intervention rather than punishment for weakness. The concept of treating mental health problems medically rather than as character failures represented advancement in medical understanding that German military culture had not achieved. American medical personnel addressed psychological symptoms with the same systematic approach applied to physical injuries. German prisoners who had witnessed traumatic events received therapy designed to help them process experiences constructively. This psychological care demonstrated concern for prisoner welfare that extended beyond physical health to mental recovery. The systematic attention to mental health needs revealed American medical sophistication that treated human beings as complex organisms, requiring comprehensive care rather than simple machines needing basic repair. The return to Germany. German prisoners returning home after the war carried memories of American medical care that influenced post-war German attitudes toward Allied occupation and reconstruction. The contrast between treatment received as prisoners and conditions in defeated Germany was stark and politically significant. Many former prisoners became advocates for Western medical practices and democratic values, understanding from personal experience that American prosperity enabled humanitarian policies that German propaganda had claimed were impossible. The medical care received in captivity provided credible testimony about American character and capabilities that contradicted Nazi propaganda narratives. Former prisoners served as unwitting ambassadors for democratic values, sharing first-hand accounts of treatment that exceeded their own country's care for its citizens. Effectiveness. The economic foundation. The abundance that enabled superior medical care for enemy prisoners reflected American economic capacity that operated beyond German comprehension. The ability to devote substantial resources to prisoner welfare while simultaneously supporting global military operations demonstrated industrial capabilities that no other nation possessed. The medical care provided to German prisoners was supported by economic systems that generated wealth through productive efficiency rather than resource extraction. This abundance enabled humanitarian policies that would have been impossible for nations operating under scarcity constraints. The final testimony. Decades after the war, former German prisoners continued to cite American medical care as the most shocking aspect of their captivity. The contrast between expected brutality and actual treatment remained vivid in memories that shaped post-war understanding of American character. Franz Meyer, the soldier whose infected leg wound was saved by penicillin, lived until 1987. In his final interview, he reflected, "They could have let me die. My leg was infected. I was just another enemy soldier. Instead, they gave me medicine worth more than a gold, surgery that saved my limb, and care that proved America's strength came not from its ability to destroy, but from its commitment to preserve life, even enemy life." The bedside table in that American hospital, with its Bible, fresh bandages, and steaming coffee, became a symbol for thousands of German prisoners who discovered that their enemy's greatest weapon was not hatred but humanity, the systematic application of American abundance to the preservation of human life, regardless of uniform or ideology. In the end, the medical care that saved German prisoners' lives demonstrated that American victory was built not just on industrial capacity or military skill, but on moral foundations that valued human dignity above ideological revenge. For enemies who expected death, the gift of healing became the most powerful testimony to democratic values, proof that some societies were strong enough to show mercy, wealthy enough to preserve enemy lives, and confident enough in their principles to extend humanity even to those who had sought their destruction.